Good afternoon. My name is Brian Gromkowski. I'm one of the Assistant Directors of Graduate Admissions here at William Patterson University. I want to thank all of you for taking time out of your schedule to join us today. I think it goes without saying. These have been particularly difficult 11 plus months, and we know that time is perhaps even more valuable than ever now between virtual learning, work requirements, shifting and unpredictable schedules. We really do appreciate you taking time out to join us for our webinar. I'm joined by Dr. Kem Louie. He's going to talk in just a moment about our Master's in Science in Nursing, our on-campus offerings, as well as my colleague Christina Aiello, who is the liaison and would be able to also field any questions that you might have. So just two things I want to make sure you're aware of before we get started. First, we are recording this presentation in its entirety. Again, in reference to the time I mentioned before, I know sometimes attendees need to duck out early, maybe end up missing a couple slides for one reason or another, or join us a few minutes late. So we are going to be sharing an email with you by the end of the week that will include a direct link to our YouTube channel where we'll house the recording of this presentation. If there's information you need to refer back to or something you might find helpful later, we want you to be able to take that in from the comfort of your couch or elsewhere at your convenience. Second thing I want to make sure you're aware, if you do have any questions as we go through, or if there's anything you want Dr. Louie to speak in greater detail about, you can type your questions in the chat box there on the GoToWebinar screen. We will make sure that if it's something quick and easy, my colleague Christina will field your question. If it's something that would be of benefit to the audience to hear at the end, we will read the question off and have Dr. Louie answer it on the back end of the presentation. So I know you're not here to listen to me talk. You want to hear what Dr. Louie has to say. So without further ado, Dr. Louie, take it away.
All right. Hi, everyone. I'm really glad, as Brian said, to take some time out to learn a little bit more about our graduate, particularly MSN program. Let me just move the slides. I'm Dr. Louie. I'm Professor and Director of the graduate programs. Besides the Master in Science in Nursing program, we have a postmaster's. I'll mention that in the slides, and we also have a doctoral program. That's why it's the graduate nursing programs. Okay. This is a great time to come back to school. If you've been thinking about it, it's not a decision that you need to make in a hurried way, because it affects not only yourself, but it also affects work, and it affects your family life, your social life. But if you've been thinking about it, it really is a good time, particularly for the nurse practitioner programs. I heard that the salaries are going up, and there really is a shortage of COVID. There's many things we've learned through this pandemic, is that we need nurses, and we need nurses at the advanced practice level. So this slide addresses the fact that we are accredited. We are accredited for 9 more years. We have the full 10-year accreditation for the MSN program, as well as the postmaster's program too. All 3 programs were evaluated about a year and a half ago. So we're very excited about that. CCNE, which is the Commission on Collegiate Nursing Education, is our accrediting body. So you need not worry. In regards to just admission requirements, because these are usually the first question I get, besides, you know, I'm going to go back to school and this is what I want to do. There is an online application. You could also find it on the graduate nursing website. Of course, we need your BSN transcript. We are looking at a minimum of a B average, which is a 3.0. Anyone who has a GPA less than 3.0, please contact me. We don't want your GPA to determine your future, but there are circumstances which I understand. We do require that you have an undergraduate prerequisite courses in statistics, health assessment, and nursing research. And most, if you've graduated, I believe in the last 10 years or so, you would have that. We do need a resume. We want to know what you've been doing since you've been since you've received your license. We are requiring 2 names of references. We don't need a full reference anymore. So as most people do on a resume, believe me, in nursing, it could be more than 1 page, but we need to have a name in case we want to just contact them for any reason. Usually we prefer that you identify a faculty member, or a former faculty member, or a current manager or supervisor. We do also, because this is a graduate program, and most graduate programs do require at least a year of work experience, because graduate students in many of our classes they do a lot of discussions relating to their work environment. As far as deadlines for the MSN program, we are now accepting applications for the fall semester. This is in our traditional program of August 1st. I'll explain a little bit about traditional program a little bit later on. And then, of course, we accept admissions twice a year, fall and spring. Okay, let's see the next slide. Okay, this is where I talk about the two programs now. We have a new fully online program. The courses are 7 weeks instead of a traditional 15-week semester. Most of you probably are familiar with spring and summer and fall and summer. I call that traditional. And we have, like I said, a fully developed online program. It's an MSN. It's the same curriculum that we have, but you would come to campus. Of course, no one's come to campus for the last year or so. So all of our courses, because of the pandemic, has been online. Some of our courses are synchronous, meaning at the same time, you'll be seeing everybody in your class talking to the professor. That's a virtual synchronous, whereas in our fully 7-week online program, it's asynchronous. You don't really have the opportunity at any one time to talk to your classmates or to your faculty. You may do it with your faculty if there's some reason. Let's see. Oh, I did mention that you do need, for our traditional on-ground, and they're using the term on-ground, it's new to me, must have an active New Jersey license. Whereas if you're interested in the fully online program, you need to be licensed in that state. Okay, we mentioned a little bit about GPA, and the prerequisites are the same for both programs. All right. We do have 4 tracks, or sometimes they're referred to as concentrations. We have a nursing education track, administration track. Right now, the administration track is not running in the traditional 15-week program. We do have it running in the 7-week program. That's due to the number of students is really the issue. We have a large adult gerontology nurse practitioner program in primary care. I have to mention it's in primary care, not in acute care. So if you want to come to our program and you're interested in primarily working with adults, which is late adolescents to 100 and something, you would come into the AGNP. And this is working in community settings, medical offices, long-term care settings. Okay, but whereas in the acute care program, which we do not have, it's primarily in hospitals. Our last track is the family nurse practitioner program. I put the credits there for you, which is pretty competitive with most programs. The family nurse practitioners, of course, take care of neonates all the way up to 101 or more. All right. Okay, these are just the listings of courses. It's not something you need to memorize, but I think there is a schema to a curriculum. And this is what we refer to as the graduate core courses. If you have investigated and looked at other schools, you'll see courses like theory and research, policy. Those are sort of, because you're obtaining a master's degree, besides the fact that you have courses and clinical courses that would make you eligible to sit for a national certification exam, whether it's an NP certification exam or an education certification or administration certification. But all the students take the graduate core courses, not necessarily in this order, but I kind of list it by course number. There are some clinical courses that are required in the MP program, and there are courses that are clinical courses in the education as well as the administration program. Oh, okay. You can find the curriculum on the graduate nursing website if you're really interested. Some of students have taken a course elsewhere and decided maybe that's not the good fit for you, or you are an online program, but your learning style tells you you'd rather sit in front of a professor where you can talk with someone. So you may have taken a course. We do accept, of course, transfer credits, but the courses must be comparable to the courses we have. They may have a different title, but once I see the course description, Sometimes if I'm not quite sure, I send it to the faculty who's teaching the course and say, hey, what do you think? Can we transfer it in? Does it have at least 80% of the knowledge so that it's not repetitive? So we work with you in that way. We can take up to 49% of our current curriculum. So it's more than just one course. This is just the courses in the administration track. And again, this is being offered online, not in our traditional 15 weeks right now. What is, we think, a value in our nursing administration track as opposed to other programs is that these are 9 credits down below here that you're looking at that are taken in the College of Business. These are the foundation MBA courses. You do not get an MBA, of course, because it's only 31 credits in our nursing administration track. But just to show you that if you are an administrator, I know there's other people on the line, you might say, you know, I was thinking about an MBA. Gee, I've already knocked off 9 credits in my nursing administration track. So we think this is a value added if you choose to come, if you're interested in nursing administration program. These are our nursing administration courses. It's graduate core plus the specialization course. There is one clinical course, which is 7255, and it's 170 hours. You'll be in a situation where you're either working with a supervisor or a manager, and sort of shadowing and doing projects with them. I think now we're just going to talk about some of the concentrations that we have. This is the nursing education track. Again, these we do ask because our accrediting body requires that our nursing education folks must have patho, health assessment, and pharmacology, advanced pharmacology. And in some schools, if you've looked at the nursing education track, some schools combine patho and pharmacology. Some have combined physical assessment and patho, but we have 3 separate courses that we provide for nurse practitioners, and we ask our nurse educator students to sit side by side. And it's a little daunting in the beginning. No, you're not going to be a nurse practitioner. That's not the point. The point is you are a nurse first, and that these are 3 courses that are grounded in the clinical area. So our educators do just as well as the NPs, and they walk out of that course a little dizzy, but learned a lot. These are our these last 3 are specialization in regards to our curriculum. We do have you teaching side by side with one of our faculty. You're sort of mentored by them. That in this particular course, we do have a clinical course I'll show you later, but there's about 45 hours. So we do give you a good hands-on experience as a nurse educator. So let's move on to the adult nurse practitioner courses. Again, here's what we call the 3 Ps. It would be advanced patho, advanced physical assessment, but nursing we call it health assessment, of course, and advanced patho. So our NP tracks have the three Ps, and we have basically 2 clinical specialization, which looks at health promotion, health maintenance, health restoration across the various systems. So it's 6111 or 6121. And a clinical course. There are 3 clinical courses in the AGNP program. And then in the family nurse practitioner program, you have your 3 Ps again. This goes across the adult. There is a special advanced health assessment course for just the child and the childbearing client. All right, these quite sort of like the OB, but more so focused on the child. And there's this course is for the FNP. So you're taking the 6111, the 6121, as I previously mentioned, and this focuses particularly on the FNP aspect. And there is another clinical. So of course, the family nurse practitioner have more credits, and you would earn more hours in order to take the examination at the very end. I mentioned earlier, we do have another program. I don't think. If someone is on the line, if you already have a master's degree in nursing and you say, listen, you know, I'm a nurse educator, but I always want to be at the clinical bedside. I really want to go for my FNP, for instance, but you already have a master's. So you would come into what we call, it's not a degree program, it's a certificate program. And we would look at the courses that you took. Let's say, like I said, if you're a nurse educator, you may have already had the 3 Ps. You're a recent graduate, so you don't need the 3 Ps. I would only accept these 3 P separate courses if they were taken in a program that had nurse practitioners. Otherwise, these are the 3 Ps, as you probably know, are the foundation to clinical and diagnostic decision making. All right, so these students in the postmaster certificate program, we would look at your courses that you took, and then this is called a gap analysis, and see what courses that may be comparable to being able to sit for certification. Now, of course, if you're a nurse educator, you wouldn't have had all the diagnostic and management courses, so you may have to take that. You may have to also take clinical courses along with that. So you would either write to me, and if you're interested in the online, I would send it to the online coordinator to look at the gap analysis. All right. I don't mean to rush through it. I'm just sharing, because most people, okay. Again, I've talked about the fact that we have 2 types of program. One is our traditional on-ground, which is 15 weeks. Summer, fall, and spring. Summer is a little shorter. And then we have our new online, fully online, which are in 7 weeks. So you wind up taking 2 courses a semester in the online program, whereas some students start out with 1 course over 15 weeks. You need to know your learning style. It sounds great. Oh, I can knock it off in 7 weeks. But to do patho, advanced pharmacology, and you have children and other obligations, 7 weeks may not always benefit you. But obviously, if you're from out of state, this is probably a very popular choice. There is a week in between the 2 7 weeks courses. It's just the way it's made up. Next, in regards to financial aid, William-Paterson does provide financial aid to graduate students. It is a federal loan program. It's not a scholarship per se. As we know it, it's a low-cost loan program, but you must be eligible if you take 2 courses at one time. In our traditional 15 weeks, you need to have 6 credits. In the online, you need to make sure you take 1 7-week course and then you register for the other 7-week course. Otherwise, you would not be eligible. There is a special program that we have. I just do want to mention, there's a lot more information on my website. It's called the Nurse Faculty Loan Program. And this is also federal monies for tuition. The catch, okay, is that you must be a nursing faculty. We also have a nursing faculty shortage in nursing too. It's been long coming for sure. Once you are able to get the tuition for the 3 or 4 years, you must again be eligible for the loan, meaning that you must take 2 courses at one time. Then for every year that you work as a nurse faculty, part-time or full-time, but you must, if you're going to work part-time, you must have 2 part-time jobs that's equivalent to a full-time job. They've been changing a little bit on the requirements, but the whole point of all this is that it's a tuition forgiveness program. Some of you may not be familiar with it. And I think it's worth explaining because it's a wonderful program that several of our students are in. But you can be a nurse practitioner or a nurse educator or nurse administrator. But I mean, most of the people that take advantage of this particular program that I have is nurse educators, not so much nurse practitioners. But the tuition forgiveness is that if you work 1 year after graduation in a nurse faculty position, not just William-Paterson, it's an associate degree program or another program, a full-time job, then we can cancel, I guess, a certain percentage of that. After 5 years, after you see the term 5 years here, if you're still working and eligible for the loan cancellation or forgiveness, 85% of what you borrow is completely canceled. So you only pay 15% back, actually to us, to William Patterson, and then we put it in a pot, and then we use that money for somebody else. So I didn't mean to go on and on about it, but if you qualify and interested, please contact me. All right, let me see what we have here. These are the current tuitions you could find on our website for our traditional on-ground program. I didn't have the online tuition cost, but if you can write to me, or you can, at the end of the thing, we can give you a website where you can find that information. So in-state, approximately with the fees, it's $746 for one credit. So if you round that off to, let's say, 800 times 3, one course is about 2,400. About. I mean, I always kind of add it up a little bit because there's always book money and stuff like that. So if you're working off a hospital tuition reimbursement, we will give you a letter at the end of the course, that kind of thing, because usually grades come out a little bit later. So again, this information is available online. We don't have the cost for fall 2021. The Board of Trustees usually doesn't meet until the beginning of April. The tuition's only been going up about 2% every year. So, but this is the current tuition. All right, let's move on here. Oh, we're almost near the end. Either I was talking very fast, but this is me. Please, I prefer email. I do go into the office once a week, but it's better. I'm usually better at the email. Dr. Cheryl Hollema is the online program coordinator. So this is her email here. If you have specific questions about the online program, you can contact Jamie Jennings is our program assistant. So she's up on the latest information, and she generally can also answer questions. I don't have anything to ask. Do we have any questions on the line?
Thank you very much, Dr. Louie. At least as of right now, we haven't had any questions come through yet, but I always like to go through and just do a quick bit of housekeeping, and sometimes that minute or two allows anyone who might have a question or two that they're working through to type them in the chat box. First, for anybody who may have joined us late, I want to remind you that we are recording this webinar in its entirety, so you are going to be getting an email from our office before the end of the week that will include a link to our YouTube channel. So if you need to catch up on anything, or if you want to refer back to anything you heard today, you'd have the option to do so at your convenience. Also, it does look like a question did come through. Hang on. Dr. Louie, the question is, will this be the first FNP online program at William Patterson? And
Yeah,
perhaps in the area, I'm not sure how prevalent it is with some of our peer schools, to your knowledge.
I didn't catch that last part, Brian.
I was saying, and I'm not sure if you're familiar with if any of our peer schools have a similar program, a comparable program, or if we're one of the first
in New Jersey. I don't. Maybe Felician might have an. I believe their program may be online. I know a lot of it is online. I'm not sure if it's fully online, such as ours. Again, we started this past fall with the core courses. So we have plenty of students in the FNP. That's generally the more popular track that NP students choose. Some of them may graduate with an FNP, but may not work with children necessarily, but it does cover the gamut. I've also heard that in some of the ED departments, that they prefer FNPs as opposed to AGNPs because if a mom or a child walk through the ER, the AGNP would have to step aside. I hope I answered your question.
I believe so. And then for your department in general, and obviously this is something that every department has had to deal with a little bit differently, but could you speak a little bit to how COVID-19 and some of the remote instruction and other changes that have had to happen due to the pandemic, how the department has sort of integrated that into the way courses are being taught, the modalities that you've experienced in the last 2 semesters?
Well, primarily our traditional program has always been what we call hybrid. We've had face-to-face classes. We've had classes that are face-to-face. When you get into the specialty courses, they may meet every other week, and then the other every other week is some Blackboard assignment online. So that's what we call hybrid. We may have had 1 or 2 courses that were fully face-to-face for 15 weeks. Well, obviously, these past year, they had to convert totally to online. They may, what I'm finding in some of the professors, because the students that come to us, our traditional program, is because they want to talk to somebody in real time. So some of the courses, I'm trying to think of one off the top of my head, because I know many of the professors, is that they'll do something online asynchronous, and then the following week they'll come together virtually, but it's still online. Part of it is because, you know, to maintain the safe distance and the mask, all of us, some of our undergraduates still have to go to our lab because they're doing the practice skills. There's really no way to do that. Our health assessment course, when they need the lab, they'll meet, and then they have to keep safe distance, and then we have to clean up after and all that. But that's the only course that really has been meeting online, I mean on ground, maybe every other week or every 2 weeks, is the advanced health assessment course. But it's changed in that way. Some of the faculty love it, some of them, they're tolerating it because they like the face-to-face interaction. So yeah, I think it's changed a lot. I think they're getting better at it. The curriculum is the same. The objectives is the same. I haven't heard much in regards to students not being accessible. If anything, I have to be honest with you, faculty are more accessible to students via this online because you're always emailing back and forth kind of thing. I guess that's how it's changed. We do hope to go back to a hybrid model. We don't know exactly when. Of course, we have to wait till the governor and other schools. The president is hoping by the fall, but we are doing registration currently for fall. Well, no, not yet. In about a month's time, we'll be doing registration. The courses are the courses, but right now everything has been turned basically online. I hope that answered your question.
Thank you very much. It looks like there are no questions as of right now, and certainly I know Dr. Louie put her information up before, and certainly you can always contact the graduate admissions office as well if you have other questions that you think of. An hour, a day, a month from now, whatever the case may be, we'd be very happy to hear from you. If you haven't already and you're interested in what you heard today, we would certainly encourage you to get started on the graduate application online for one of our MSN programs or one of the postmaster certificate programs. They're all available up there. There's information online on our website as well. So certainly hope to see your application in the near future. Otherwise, Dr. Louie, if you don't have anything else you want to add, we want to thank everyone again for coming out and giving us your time today. We hope that this was helpful and you got all the information that you needed in a relatively short amount of time. And now we'll let you get back to the rest of your daily schedule, and otherwise hope to hear from you soon. So thank you so much and enjoy the rest of your week. Take care.
Bye-bye. Stay well. Thank you.